Well, hospitals in Washington are filling at an alarming rate as coronavirus infections surge. The state's health department reported more than 3,000 new cases and about 40 new deaths this week. More than 6,500 people have died from COVID across the state. And so far, new mask and vaccine mandates could help save lives and give hospital staff some kind of relief. For more on this, we want to bring in urgent care nurse practitioner Gill. Justin, thanks for joining us. It sounds pretty dire in Washington. The CDC has said that cases aren't expected to peak until late September. Can you tell us what you're seeing? You know, who's being admitted, who's contracting the virus and getting so sick that they have to go to the hospital?
Yeah, thank you so much to both of you for having me this morning. I would have to say that, you know, the numbers are being reflected in my day-to-day practice in an urgent care clinic where we see patients, we test patients and counsel patients on suspected or confirmed COVID-19 infection. And I'll say, you know, our volumes on our COVID unit of our urgent care clinic, as well as our non-COVID, meaning everything else that people need care for, has gone up. And I think that that's particularly for two reasons. One of them being Delta variant, which has significantly increased the number of cases, particularly among unvaccinated individuals, but much more severe disease, even in younger individuals. Other people that would be, you know, otherwise healthy are getting much more severe illness and oftentimes being sent to the hospital or the emergency department because their oxygen level is too low or they're getting much more sick. On the flip side, we have other healthcare conditions, many of which have been either neglected or postponed as a result of the COVID-19 pandemic. And we've tried our best to be able to manage those health concerns as well, because while many of them may not be urgent surgeries or urgent or emergent procedures, many of them are very necessary for people to live their lives and be able to maintain their health. So our volumes have ticked up in the outpatient setting. Our volumes have hit, in some cases, near maximum capacity in many of the hospitals in the state. And I can definitely say it's reflected in my day-to-day practice.
Justin, a new mask mandate went into effect in Washington last week. A lot of people have wondered if masks are as effective now with the Delta variant raging because the viral load is greater. I know that there's some people who have questions about that as they try to understand the effectiveness of masks. Can you help us understand?
Yeah, absolutely. And I would actually say that because Delta variant's our viral load is much higher, that's more of a reason to wear masks. What that does, when you wear a mask, it protects you from spreading the virus to other people. It creates that barrier so that way when you are around people and you may potentially be contagious or in the few days leading up to developing symptoms, that you're less likely to spread it to other people. We do know that when people are symptomatic, the suspicion is that they are carrying a lot more virus that can be spread to other people. And we encourage them to follow the quarantine protocol if they do test positive for COVID-19 or get tested if they're unaware. But wearing masks has been the one thing that we know works throughout the start of this pandemic. It's going to continue to be a tool that we have available as we deal with this COVID-19 pandemic. It is something that is safe. It is something that is not harmful to you. I wear a N95 mask all throughout my 12-hour shift in my urgent care clinic whenever I'm on our respiratory side, and a regular face mask throughout the day. Nurses, physicians, healthcare workers, frontline workers are wearing masks on a day-to-day basis to protect you as well as their coworkers. But we already know there's been a multitude of studies that show the safety and efficacy of mask use. And it's one of the most important tools that we have right now as we're struggling to battle the Delta variant.
I think that, I don't know if you need more proof than that, but here you are working through the entire pandemic. You were dealing with people who you know have COVID. You're wearing your mask. You're washing your hands. You didn't get COVID. Like, if anyone needs, so you don't believe all the studies, here's just anecdotal evidence that masks make a huge difference. But let me ask you about children. Seattle's Children's Hospital confirmed their very first patient death from COVID-19. As you know, children are still too young to receive the vaccine, 12 and under. But the CDC director says that as soon as they are available, the vaccine is available to children, kids should be able to get the shot immediately. You know, there's people out there that are going to say, you know, I took the vaccine because I'm an adult, but I don't know if I want my kid to take the vaccine. And if kids don't get very, very sick, then why are we making kids take the vaccine? I want to ask you, how essential is a pediatric vaccine to us getting a handle on this pandemic?
That's a great question. And I think that that's also on the minds of many parents as schools are starting to open up. I think what we've learned from vaccination is that it's not just an individual tool to protect yourself. But if we get a large number of people vaccinated, it reduces the chance of the virus being able to spread to other people and either further cause mutations, either cause severe disease, or affect people that might potentially be immunocompromised. Children are particularly unique because they're children. There's a higher threshold for evidence, higher threshold for rigor when it comes to the evidence to support the use of vaccines. We do know that in younger adolescents, so 12 and up, that it is very protective for them. But we do know that children themselves are not completely immune from severe disease when it comes to COVID-19. Since the Delta variant started to become the dominant strain, I've sent some of my youngest patients to either the pediatric hospital or a local hospital. And it was shocking to me, but it was shocking to the parents, mainly because there was a perception that kids were going to be fine with this. For the most part, they are. But we do need to do and take care of all of the children that are in our schools, use every available resource and tools, and part of that is vaccination. Vaccination is safe, vaccination is effective, and the vaccines have been well studied with an added level of rigor and thoroughness when it comes to approving or potentially improving children's vaccines.
There's a new study out of London showing that the vaccines can cut the risk of the virus turning into long COVID. Talk to us more about that and how this works.
Yes, I read that study that came out yesterday, and I think it's great news for people that may potentially get a very rare breakthrough infection and the risk of long COVID. If we can reduce COVID-19 down to a minor head cold that does not have any lasting effects, then that's a good thing. The one thing about COVID-19 is that the infection oftentimes causes long-term symptoms, such as long-term shortness of breath, fatigue, loss of taste and smell. I've seen patients that have come in for 3, 6 plus months with a loss of taste and smell. That impacts someone's quality of life. I've seen athletes that have come in with persistent shortness of breath, chest pains, palpitations, going on for months after their initial COVID-19 infection. This is another sign that vaccines are going to be our way out of this crisis. If we can get COVID-19 to something that we can live with or manage well and not be as worried about long-term symptoms or severe disease, that's a win for all of us. But this is great news that by cutting the risk in half of developing those long-term symptoms, we can make a major impact on this pandemic.
So
you are a nurse practitioner, and so you know a lot about this. There's a nursing shortage in this country. The American Nursing Association sent a letter to the Biden administration over a severe shortage of nurses. It was happening before the pandemic. Can you talk to us a little bit more about, what you're seeing in terms of this shortage, the impact that it's having on the ability of our system to handle the increasingly sick people that are showing up? You said not just the people who suspect they have COVID or have COVID, but other people are showing up at your clinic. And also, what you hope the administration can do to help.
Yeah, the nursing shortage is something that has been a longstanding issue, definitely been exacerbated by the current pandemic. And I think that that's for a number of reasons. One, we have a strain and we've always had a limited inflow of nurses, as well as other frontline healthcare professionals due to faculty, education resources, that type of thing. Another thing with this pandemic specifically is that nurses, myself as a nurse practitioner in a provider role, we are in front of patients and facing patients every day with a virus that it can be scary for many. You're seeing patients with severe disease, and you're constantly exposed to them on a day-to-day basis. And we are putting ourselves at risk. This is a very risky profession. It's something where our community needs it, but it is something that we kind of keep in mind when it comes to our day-to-day work. The other part of this is when people come in with severe disease or are unvaccinated, sometimes they don't want to necessarily listen to some of the recommendations given to us as healthcare workers that are seeing many of these cases on a day-to-day basis. And that's very frustrating for us because it gives us some kind of sense that people may not be listening to us or they may not be believing us. And what I tell patients is it's a sign of strength if you get vaccinated. It's a sign of strength if you wear masks because you're protecting us as healthcare workers and nurses on the front line as well. So, I think that the Biden administration is needing to recognize this as a national crisis. The American Nurses Association has announced that they've asked the Biden administration to announce that this is a national crisis. And we need to focus more on this because if we continue to go down this road of adding more stress, adding more demands on our nursing workforce and our frontline healthcare workforce, we're going to see some signs of our healthcare system either decompensating or falling in many areas.
All right, Justin Gill, as always, we appreciate it, my friend. Thank you very much.
Thank you.